Assalamu alaikum, everyone. And once again, I am Farah Abul. I'm a third year medical student. And for today, I will not be giving you an immuno crash course. Instead, I will be taking you through the neuroscience block, inshallah. So I have already asked a couple of you how the block has been so far. And alhamdulillah, the feedback has been positive, which I'm very, very happy about. Through this talk, I will try my best to give you a better idea of how to approach this block, how to go about actually studying it, how to be as prepared as possible for the final, and just generally how to avoid the mistakes, the plenty mistakes that I did so that you can hopefully have a better experience. Now, the neuroscience block is obviously centered around the nervous system, and it's a very, very common misconception that the nervous system is called the nervous system because of neurons and nerves, when in reality, it is called the nervous system because he do be looking kind of nervous. Now, if you were to ask me before the neuroblock how I felt, I would tell you that I was very, very nervous as well. However, if you were to ask me about my experience during, I think this should give you a bit of a good idea. So just take a moment to look at all those messages, take a moment to look at those texts. Special thanks to the people that contributed to all of these. Take a moment to just tag yourself, basically. You might need life support at some point. You might feel like a floating chicken nugget. We all go through those moments. And for my personal favorite, who is solitary? I honestly don't know. So just take a moment to absorb it all, take a moment to appreciate everything that you're seeing. And this pretty much sums up the neuro experience. And I think that is absolutely beautiful. However, to take a look at something a bit closer and a bit more personal, what was my personal experience with the block actually like? I will not lie to you and say it was all sunshines and rainbows and ponies. A bit of a backstory about me is that neuro is the entire reason I even joined medicine. So from the get-go, I had a goal in mind. I knew what I wanted to be doing. I knew where I wanted to go. And even in first year, whenever a nerve was mentioned, whenever any neuronal pathway was mentioned, it would almost be like my ears would just tune in and I would be hyper fixated. I would immediately try my best to retain that information so that I'd make good use of it in the future. The closer I got to the block, the more excited I got. And in POD, I was like, oh my God, I'm so close now. I can almost touch it. I'm so excited. I'm so happy. And I used to always hear people constantly complain about POD and say POD is a very, very difficult block. POD is the one that you should be worrying about. POD is super hard. POD is the like bane of everyone's existence. And so I thought, okay, since no one's complaining about neuro, then obviously if I can get through POD, I can get through anything. And that unfortunately was not the case for me. I struggled a lot in the neuro block. I felt very dejected. I reached a point where I was like, oh, why am I not doing as well as I would have wanted to? Why do I feel like I'm not actually enjoying this as much? And I began to doubt myself a lot. And looking back at that now, I realized that the reason why I felt that way is because I felt alone, when that really was not the case. I felt like my struggles were only mine to suffer with. I felt like everyone else was having a super easy time and that I was the only one facing difficulty. And that is not the case. And the reason why I'm sharing this with you guys is not to scare you, but to tell you that it is okay for you to share that burden. It is okay for you to realize that it is not your fault. There's nothing wrong with you. It is just that this block might be a bit difficult to navigate initially. But once you get the hang of it, which alhamdulillah I was able to do, it becomes very fun and very beautiful. And if anything, the neuroscience block cemented to me that this is what I want to be doing for the rest of my life, inshallah. Obviously, with rotations, you can get to see that. And I'm not saying that you have to go into neuro, but just don't feel like you are alone and don't feel like you have to be perfect in absolutely everything from the get-go. It is okay to fall as long as you are able to get back up again. I'm hearing an echo to my voice. Okay, I think it's gone. All right. So moving on to the actual bulk of what the neuroscience block is. The neuroscience block, or as I like to call it, the big boy, is an 11-week block. So you should basically expect yourself to go through absolutely everything. You're gonna have those good days, you're gonna have those bad days, you're gonna have everything that you could possibly imagine. It's the 5 stages of grief, but luckily at the end of it, you do get up and you do get out of that. It is 6 credit hours, which can be very frightening for some people, but I don't want you guys to have that number weighing you down. I don't want you guys to feel like, oh, if I don't get an A in this, it's going to be awful. If I am not able to do well, you will do well, inshallah. Don't let that number intimidate you. It is okay. You will be fine. Just consider it a block like any other that you have to work hard for. And obviously, your best is more than good enough. The block director is Dr. Ahmed Yaqeen, who you have already had for a lot of your lectures. The midterm is going to be on February 18th, and the final is on April 15th. So you have about 2 months between both of those exams. How does the block actually function? Now, typically the way they conduct the block is from distal to proximal, i.e. you would have the nerves, the spinal cord, then you'd have the brainstem, cerebrum, cerebellum, basal ganglia, so on and so forth. And they also transition from the sensory motor system to the higher mental functions in psychiatry. So the way they do that is in week one, which you've already finished, it's just an introduction to the block with embryology, histology, and basic concepts about action potentials. As you transition to week two, which you guys have basically almost finished, you should be taking the spinal cord and its lesions. The spinal cord, in my opinion, is very, very, very fun. So I think the echo is whenever someone else has their mic unmuted. So if you guys could just please make sure that you're muted for now. We'll have a Q&A session at the end where you can unmute. Right. The spinal cord, as I was saying, in my opinion, is very, very, very fun. It's just somewhat difficult to get the hang of at first. However, once you get over that initial step, it's going to be incredibly enjoyable to go through. It's going to be something that you actually feel like you understand very, very well. And what I would recommend to do in general is that you try your best to take it both ways. So the block goes from distal to proximal, study it like that, and then try your best to work your way back, proximal to distal. When you transition to next week's brainstem lectures, the notorious brainstem that everyone probably freaks you out about, it is not difficult. It is just a lot of content. So try your best to be on time. Try your best to get everything done before you reach brainstem. Now, as you transition to week 4, it's going to be the cerebrum and CNS tumors, which are taught by Dr. Akif and Dr. Imad, respectively. Then you move on to the thalamus, cerebellum, the basal ganglia, and finally, after you're done with the midterm in week 6, you move on to psychiatry post-midterm. So that brings me to my next point about the actual disciplines of the block. What will you be covering? Pretty much just select all. Everything that you've taken in first year alongside everything that you've done in POD will be included in the neuro block, which seems like a lot. However, it gives you this unique insight into being able to interconnect everything. So I want you guys to imagine that the neuroscience block is a painting and each of you is carrying a brush. And I want you guys to be able to create art that you can step back from and look at as a whole. Every brushstroke is going to be very meticulous. Every lecture that you study is going to be very, very detailed and very intricate. However, every single one plays such a major role in creating that beautiful picture and painting that image that you'll be able to see once you take that step back. So look at the nervous system as a whole. I don't want you guys to just study it as, okay, I'm going to do all of anatomy, then all of physiology. I don't think that will give you the true image of neuro. I think that you should take it as a system as a whole, and you should try your best to interconnect all the disciplines together. That being said, for pre-midterm, I'm not sure if you can see my pointer. Just a second. Can you see my pointer? I think you should be able to.
Yes.
All right, perfect. So for pre-midterm, you are going to mainly be having anatomy as the bulk, alongside physiology, pathology, pharmacology, and then a bit of neurology or clinical. Post midterm, you will focus more on psychiatry, microbiology, immunology, neuro radiology, and obviously you have your labs all throughout. I just like to make it balanced with 5 and 5. Okay, so the labs are everywhere. Now, how do you actually approach each of these disciplines, and in what order should you study them, or how should you create your study method? As I said, Have it be a story. Create your own plot line and follow through with it. So start off with what is normal. Go through the anatomy, and that obviously includes embryology and histology. Go through the physiology and correlate between those two. After you know what's normal, it's going to make a lot more sense for you to take what is abnormal because you know what can basically go wrong. So move on to the disease process. You do that through microbiology, immunology, and pathology. Okay? Now, I would recommend doing microbiology before pathology just because sometimes they might reference back to the microbiological agents that you have taken, so it might be a bit easier to interlink those two. Okay, I know the disease. How can I actually deal with it? How do I treat it? And to do that, you go to pharmacology. Now that you know the pathophysiology of the disease, now that you know what is normal, you want to basically be able to revert that disease back to normal. And you do that through pharmacology. At the end of the day, we know all of that information, but when a patient comes to us, we might not be able to apply that, right? So because of that, the patient approach and the approach to management will be taken through neurology and neuro radiology, which are your clinical lectures. So this is my personal approach and how I think that you should approach everything. Psychiatry is very unique in the sense that it mixes both the normal and disease aspects in one. But the reason why I place it here is that I recommend you study it before pharmacology, just so that you actually know the etiology of the disease, you know how it happened, you know how it developed, so that once you take the pharmacological agents, it kind of makes more sense. Okay? How do I go through every discipline? I know the order that I should be doing it. What is every discipline that I will be facing? First and foremost, obviously, the bulk of neuro and where neuro gets its reputation is anatomy. Anatomy will be taught by three separate doctors, two of which you have already experienced the teaching of. First and foremost, you had Dr. Vlad, who basically gives you the histology and embryology. And for his lectures, the way I'd recommend approaching them is focusing on the slides a lot, because he likes to ask recall questions about the things that would not be mentioned by other doctors or in other disciplines. So, for example, he might have spoken to you guys about the different stains that are used on microscope, the different things that you might see. Like, for example, one shows you the myelin sheath, one will show you the dendrites, so on and so forth. That is very high yield for Dr. Vlad's lectures in anatomy. For physiology, I'll get to that in a second. After Dr. Vlad, you move to Dr. Yaqeen, who I'll get back to. And lastly, you have Dr. Akif. Dr. Akif will be teaching you the blood supply and the cerebrum. I cannot stress enough how important blood supply is. Dr. Akif does an absolutely wonderful job of simplifying things as much as possible, mashallah. He makes the content digestible. So I think that it would be really good for you to just focus with him. And if you find difficulty with his lectures, then Boards and Beyonds has a very good resource for the blood supply lecture, and it correlates that to the actual anatomy so that you can link between the two. For the cerebrum, my recommendation is that you do the thing I told you where you go proximal to distal instead. So try your best to see that, okay, if I were to have a lesion in Brodmann area number 5, for example, how would that translate onto everything else? If I were to have a thrombus in this particular artery, what area of the cerebrum will that affect, and how will that affect the rest of the body? This is a very, very important concept to master. And the way that you're able to do that, if you can through Dr. Akif's lectures, I feel is amazing. If not, as I mentioned, you can do Boards and Beyond. You can also do just any YouTube video, honestly, and I've linked a few at the end that I feel like are beneficial. Now, finally, Dr. Yaqeen, who gives you the bulk of neuroanatomy and the bulk of neuro as a block, my main recommendation is to attend his lectures. Even if you are not able to retain 100% of that information, even if you're only able to retain 10%, that 10% is beneficial in my opinion. He likes to repeat things in a particular order, and I feel like that pattern helps you memorize things a lot. Now that you've taken spinal cord, I'm sure you've heard him say two-touch discrimination, vibration, and conscious proprioception multiple times. And the fact that I still am able to remember it in that exact order says that it is something that works. And if you were to look at me and my friends last year, it was almost like we were in a cult just chanting to discrimination, vibration, conscious proprioception. So I recommend that you try your best to memorize things in the pattern that he presents them with, just because his questions are most likely going to use that same pattern to present the pathophysiology to you. I would also recommend that if all else fails, you go through Dr. Yaqeen's lectures multiple times. The more you go over them, the more you cement that information in your memory. And although you can definitely use external resources for his lectures, including First Aid, including Minzenerd, including Dr. Najib, including Boys and Beyond, I think that it is very important to actually refer back to his lectures as many times as you possibly can. So even if you do not use his lectures as the first study, I think that you should definitely refer back to them. And generally speaking, for neuro as a whole, try your best to have every study be as if it's your final study. I'm not saying only study once, but I'm saying it is definitely more about quality than quantity. I'm not proud of this, but I did go into the final exam with a couple of lectures on first study, and because I was mentally prepared to prepare for every single lecture as if I would immediately go to the final after that, alhamdulillah, I was able to manage and I was able to get an A. So for anatomy, since it is the bulk, try your best to go over it as much as possible. Try your best to repeat the lectures and try your best to visualize everything that you're seeing. A lot of the pictures are going to be very 2D. A lot of the pictures will not show you the relations very well. And that is where lab comes in. That is where you get to actually visualize things. And what I would also recommend is that you try drawing things out or visualizing them on your friends. So basically just try to follow along and draw a line on your friend's back and then back to the spinal cord and moved up to the cerebrum, so on and so forth. I feel like that visualization will help you a lot. So don't just read off of a slide. Try your best to actually implement that information and draw it out yourself. Try your best to explain it to someone else to cement that a lot better in your memory. All right, that was a mouthful, but that is definitely the bulk of neuro. So I think that is the most important thing that you should focus on. Moving on to what is also normal is our physiology. Now, physiology goes into the nitty-gritty details, and you're basically looking at everything on a microscopic level. Physiology is taught to you by three different doctors, Dr. Abdul Jabbar, Dr. Abdul Ahad, and Dr. Vlad. Dr. Abdul Jabbar is giving you the technical aspects or the physiology, basically. Dr. Vlad focuses more on the anatomical aspects, while Dr. Abdul Ahad focuses more on the abstract or philosophical aspect of physiology. And what I mean by that is that Dr. Abdul Jabbar will be giving you things about the action potential as he did last week. He'll be giving you the actual neurotransmitters, which are very, very, very important. And it is important to understand the types of receptors they work on, the signaling pathways that they trigger, how they are excited, how they are inhibited, and if two, let's say, neurotransmitters share the same type of receptor, how can they compete for that receptor, so on and so forth. You'll know it's a Dr. Abdul Jabbar question when it starts with a second-year medical student who was studying for their midterm when they developed a headache. And then you'll immediately think, oh, okay, so he's going to ask me about a neurotransmitter somehow. Now, Dr. Vlad, who I believe you guys have had this week, is giving you the anatomical aspect of physiology. So once again, try your best to link back to anatomy in every discipline, okay? Try your best to understand the pathways that he's going to be talking about, especially the reflex pathway, because a lot depends on it and they just expect you to know it in the future. So try your best to know how it happens, try to know the different types of reflexes that might be elicited and how they actually occur as a whole. Once again, proximal to distal, distal to proximal for everything that you're doing. Dr. Abdul Ahad is giving you guys the more philosophical, abstract aspect of physiology, in which he will be talking about emotions, he'll be talking about things that aren't very materialistic. They're not things that you can see or touch, and they are things that are under extensive amounts of research. So, more likely than not, he will tell you a lot about, oh, okay, so we still don't know a lot about this, we still don't know a lot about that. And the nervous system generally is absolutely beautiful in the sense that so much of it is still getting discovered. So much of it we still don't know about, despite all this huge amount of information that we do know. So for Dr. Abdul Ahad, I would recommend that you try your best to memorize any numbers that he mentions, just because he typically likes to ask about those. try your best to familiarize yourself with those abstract concepts and try to make them concrete in your own way. And basically just correlate everything to the other physiology and anatomy lectures. For external resources, typically what they like to use for physiology is Geisen and Hall. And for questions, I recommend BRS Physiology. All right, perfect. Now I know everything that is normal. How do I know the disease process? How do I know what can go wrong? And in order to do that, we get to look at immunology and microbiology. And the fact that I've put both of those in the same slide would drive an infectious disease consultant insane. But it's fine because you have a very small amount of lectures about both of those. You have one lecture by Dr. Garwin, and if you're good with Immuno since POD, which I've tried my best to do for you guys with the past sessions, you should be set. You are basically good to go because all of Immuno for all of the rest of the blocks, regardless, is going to just base off of those basics that you guys took in POD. It's going to build up on top of that, and it's going to be very, very straightforward. Rarely any new terminology, very straightforward questions, and it's just one lecture, so don't expect it to be very, very prominent in the final exam. Now, for microbiology, you're going to have Dr. Botta. He is teaching you guys about meningitis and encephalitis, two lectures on meningitis, which I think are very, very, very important for your final. Dr. Botta, as you have seen, is incredibly passionate and very active. So try your best to receive that passion positively and be immersed in the experience that he's trying to create for you in that lecture. Focus a lot on the epidemiological data. So here I've given you guys a table to basically show you, this is 3 out of 6 columns that we had, to show you that with epidemiology, the etiological agent can differ drastically. And this is very important because, for example, they might come to you and tell you, okay, you have this 4-year-old girl that presented to the emergency department with this headache, a stiff neck, and this non-blanching rash all over her body. So immediately you think, okay, she's 4 years old, so the most common organism is Neisseria meningitidis, right? It could also be strep pneumonia and Haemophilus influenza. But for both of those, you would have a somewhat different presentation. So you can narrow it down to Neisseria meningitidis. And you did all of that simply through knowing the patient's age. So epidemiological data in meningitis is very, very, very important. Try your best to also remember the unique pathogens that they mentioned that are specific to the nervous system. So when you're thinking of the nervous system, obviously it's going to have to be an encapsulated organism. And because of that, you need to look at all the other virulence factors. It's not just going to be, okay, this is encapsulated. If it wasn't, it wouldn't reach the nervous system. Lastly, they will also be talking about the CSF analysis a lot, either in the lecture or in the lab. And this is very, very high yield for your final, so you should be familiar with it. How does the CSF look if it's a viral infection? How does it look if it's a bacterial infection, fungal infection, so on and so forth? For resources, everyone, including myself, swears by Sketchy for micro and PAL for immunology, since you guys already have that, so you should be good to go. All right, I know immuno and micro. Let me now move on to the actual pathogenesis and pathology. For pathology, you're going to be having 3 doctors, 2 of which you have not yet been introduced to, and Dr. Uban. Dr. Uban, you have had him in POD, you know how he rolls, you know his types of questions. His lecture on meningitis is very straightforward. And now see why I told you guys to go over micro and immuno first. Yes, meningitis, once again. So if you were to study the anatomy lectures on meninges and then move on to micro to take meningitis and now move on to pathology for the meningitis lecture, it would create this cohesive image in your head. And then obviously for every other topic, you would do the exact same thing and you'd go through that same pattern again. His questions are going to depend on pictures, if there are any, and they're basically going to give themselves away by the presentation of the patient. Next, you have Dr. Shaukat. Dr. Shaukat is absolutely amazing, mashallah. He has amazing slides that are very, very straightforward, very straight to the point. You'll just see like 9 slides, 10 slides, 11 slides, and they'll be very, very cohesive, very comprehensive. And then he starts and ends his lecture typically with a question. So I would recommend that you try your best to actually interact and answer those questions because it cements the information in your brain and it gets your gears ticking so that once you actually go through the lecture again, you're able to remember that question and approach the lecture with that question in mind. Dr. Imad is the head of the pathology department. I am throwing you guys hints here, but he is very punctual and very like straight up. So try your best to please be on time and please be quiet. He does not like people using their phones. However, if you guys are actually behaving properly and doing what you should be doing during the lecture, he is absolutely amazing, mashallah. He is giving you guys the CNS tumors, which arguably I think is the most difficult pathology lecture. However, he gives it in a very systematic manner that makes it a lot more digestible. And this is how I think you should also approach his lecture. You should not just get yourself too overwhelmed with looking at the tumor as a whole and looking at all the different types of tumors that we have. I think you should approach it as the tumor name, epidemiology, i.e., is it in older individuals? Is it in children? Is it in males more than females? So on and so forth. The location, is it in the cerebrum, cerebellum? Is it in the frontal lobe? So on and so forth. The cell type, am I talking about neurons here, which is very uncommon? Or am I talking about glial cells? Am I talking about astrocytes? Then the actual mutation that might occur in that tumor. And finally, the staging for malignancy. So staging in the nervous system is very unique, and Dr. Ahmad is going to teach you how to do that. But if you were to actually approach each tumor systematically, it will be a lot easier for you to narrow things down and narrow your differentials within the final exam. So if you were to have a female patient, you're like, okay, automatically I will start thinking about the ones that are more common in females. If you were to have a child, you'll think, okay, I'm not going to go to a tumor that occurs only in the elderly. I'll think more about, let's say, a medulloblastoma, for example, so on and so forth. So it really helps you narrow things down. For external resources, the pathology department's bread and butter is Robin's pathology. So always use that for questions, always refer back to that and try your best to link that back to your learning and actually use it as a resource if you feel like the content taught by the doctors is not clear enough. All right, I figured out the disease, I figured out how it's normal and what's abnormal. How do I actually treat it? I swear to God, you guys, please stop abusing antibiotics so much because the list keeps on increasing and they're abusing me and it's just not pleasant. So please just stop. So for pharmacology, you will have a lot of faculty. As usual, it is 6 doctors, but alhamdulillah, you're familiar with all of them. You have taken lectures with all of them already in POD. You have Dr. Hatuf, who likes to just make up random mnemonics along the way. And I personally feel like they are actually very, very helpful. I feel like they are things that just click into your brain once you are studying the lecture again. So I recommend that you go through those mnemonics once she goes over them and you try your best to use them. Dr. Hatuf and Dr. Dilip are unique in the sense that they both like to ask about the name of the drug with the mechanism of action, but they do it differently. One will give you the name of the drug and ask for the mechanism of action. The other will give you the mechanism of action and ask for the name of the drug. So for both of those doctors, try your best to actually remember the mechanism of action very well, as well as the name of the drug. Now, for Dr. Hatuf, she likes to ask about the unique mechanism of action. So not just any drug that you've seen like 1,000 times. No, she likes to ask about the ones that are unique to this block, the ones that are, let's say, they have a very special enzyme, for example. So I'd recommend that you focus on those. Dr. Dilip, just to continue off of that, Dr. Dilip likes to ask a couple of questions during the lecture in his slides. And what I would recommend doing while you study is not to look at the transcript, not to listen to the recording, but look at that slide, look at that question, and try to answer it yourself. If you are able to, great, perfect. You're on the right track. If not, then try your best to recall, why was I not able to answer this? What did I miss in the previous slides? Was there something that I forgot? Was there something that I'm missing? Because he likes to interlink everything together. He might reference things that you've done in POD. Even though he will not ask you about those, it gives you a very comprehensive view of the block as a whole. Dr. Santosh, he repeat things very, very often, which some people might feel like is a waste of time when actually he's stressing on the drugs that he will most likely get for you in the exam. So he is teaching you about opioids. He will most likely get you the ones that you're actually familiar with. So he's not going to ask you like about a very random drug out of nowhere. He will ask you about the ones that you've heard before because those are the ones that you will actually most likely see clinically. So when you're presented with a patient that is taking heroin, for example, you should be able to understand the type of presentation that they're going to have, as well as how to manage that either acutely or to gradually wane them off. Okay? Dr. Dana is giving you sedative hypnotics, which is a very dear lecture to her because she tells you about her own journey with the drugs and how she had withdrawal symptoms and so on. So expect to be asked about those withdrawal symptoms. Expect to be asked about those drugs a lot. Okay. She divides the lecture per classes of drugs and then she gives you a couple of names of each drug. And obviously, since it's Dr. Dana, you only have to remember the ones in which color? Guys, which color of drugs do you need to remember in Dr. Dana's lectures?
Green.
Green. Perfect. Yes. So for Dr. Dana, if it's not in green, do not worry about it. If it is not, did someone circle Dr. Dana in green? I mean, sure, whatever works for you. If it's not in green, then do not worry about it. If it says FYI, then do not worry about it. So don't try to think, no, she might trick us, she might actually get it. She does not do that, thankfully. Alhamdulillah. Dr. Samah, you guys know how she is with like reading off the slides and stuff, but her lectures are actually very high yield and very important, especially because they have a lot of drug-drug interactions with other drugs that you'll be taking in the future. So for example, for anti-epileptics, phenytoin, it's going to pop up over and over and over again in the future. So try your best to be very familiar with the mechanism of action and think to yourself why this might be a contraindication for another drug. Dr. Manal is so a trap that I have personally fallen into, you know, when you're studying pharmacology and you're super tired and it's like so many drugs and you get to the last two slides and there's this one drug and you're like, no one's gonna ask about that. Dr. Manal will ask about that. So study everything in your slides very well. This is coming from a place of agony, okay? Pharmacology is not the best for me. I do not like this discipline, but there are ways to make it better for yourself. So try your best to once again link back to anatomy, link back to physiology, link back to microbiology, and think to yourself, why am I actually using this drug? What will this actually do for my patient? Like, for example, in sedative hypnotics, you're going to be taking drugs that act on GABA receptors. Why would they act on GABA receptors? Okay, GABA makes you more alert. It might make you more awake. So I will work on those GABA receptors and they are inhibitory. So I want to maybe excite them, so on and so forth. So don't just blatantly memorize in pharmacology. The beauty of neuro is that it is not just pure memorization as POD is. You can actually understand and make your way through things. If that was too difficult, what I personally recommend and what I usually do is that I like to make the drugs their own characters. And I like to basically navigate through stories that I create for them. As ridiculous as the mnemonics might be, it does not matter as long as it actually fixates in your head and as long as you're actually able to remember that drug. So my friends know this firsthand because I share with them my mnemonics and they've told me that because of those mnemonics, they've been able to answer questions very easily. And although they make absolutely no sense, like there was this one drug that is somehow a nice guy for no reason. He's just a very nice guy and your heart loves him. So obviously you're going to use him for something related to the heart. But that made sense to me and I was able to remember it. So I would recommend that you do the same. You create stories for your drugs, you create characters that you follow the story of that somehow links all the indications, contraindications, the side effects, the mechanism of action all together so you actually know when to or not to use the drug. Also for pharmacology, what's very important is that you focus on the abnormal side effects. So I'm not talking about nausea, diarrhea, vomiting. No, I'm talking about when suddenly, like for example, as you guys have done for chloramphenicol and POD, this gray baby syndrome that happens. This is something that is very unique to the drug. So try your best to correlate that as well as the contraindications. If that is too difficult for you, then Sketchy does also have a pharmacology section and a pharmacology folder that is very beneficial. I personally did not use it just because it was not the same guy that was doing the micro one. And as soon as I heard a different voice, I was like, I'm not doing this. But it does not mean that it's bad or it does not work. So try it if you feel like it will be helpful for you. For questions, I'd recommend using Lippincott as well as just any resource that you can get your hands on because pharmacology, since it is typically a memorization heavy discipline, you will not have much leeway with like, oh, I think it might be this, it might be that. It's going to be very, very straightforward. Okay, I know what's normal, I know what's abnormal, I know how to treat the patient, but what presentation am I actually going to see on this patient? That brings me to neurology and radiology. This is your first exposure to clinical lectures. And I understand that might be a bit overwhelming, but I don't want you guys to be very, very scared. Now, the reason I said hello, fellows, and not in the friend kind is that typically you will see that clinicians come and they might teach you as if you are a fellow. However, since you guys have a clinical-based discussion and clinical-based learning as CBLs, it is going to be something that is a lot more interactive than just a lecture. So I would recommend that you try your best to actually interact with the doctors as much as possible. Try your best to be active, try your best to answer. Even if you answer incorrectly, it will cement that information in your mind. I have actually remembered things more because I've gotten them wrong than because I've just immediately gotten the hang of them. So don't be afraid to make mistakes. Don't be afraid to explore what might be presenting to you because obviously your patient is not going to follow the book exactly. They will have this plethora of symptoms they're going to present to you with, and you need to have this broad list of diagnoses that you gradually narrow down. And the way that you do that is through your previous knowledge with all the other disciplines so that you can think, okay, if it's not this, then it could be that. If it's not this, then it could be that. Oh, they don't have this, so it's obviously not that. And through that, you basically narrow and funnel down to what you think your actual diagnosis is. So focus a lot on the patient presentation, focus a lot on the clinical features, and focus on how to correlate this back to all the other disciplines. You will also be taking strokes in this lecture. And once again, this ties back to why blood supply is so important. The main pathology that you worry about so much in neuro is going to be strokes. Because if a patient has a stroke, you have very limited amount of time to actually get the brain back and get the brain healthy again. So be able to recognize the signs of a stroke, be able to recognize how or where it might be, and be able to correlate that back to your anatomy and the loss of function that you might see in pathology, for example. Dr. Hissam is going to give you the Neuro Radiology. Now, the lectures might be long, but luckily they're not that high yield for the final. I'm not saying don't study them. I'm not saying they're not going to come. I'm just saying that Dr. Yaqeen realizes for both of these disciplines that they might be a bit too advanced. So alhamdulillah, he's very lenient with that and give him feedback consistently so that he knows how you guys feel and so that he can gauge how this block is actually going for you. And then through that, he'll be able to adjust the questions accordingly. His lectures are going to mainly be about the abnormal things that you can see. He's not going to be going much over the normal anatomy that you can see in radiology. So try your best to be able to recognize the different types of strokes that you're going to see. So for example, if I were to tell you the third years that are here, answer this for me. And if you're not able to answer this, you'll get something tomorrow. If a patient comes to the clinic with the worst headache of their life, they tell you this is the worst headache I've ever had. It's like,
Subarachnoid hemorrhage.
all right, there we go. So you need to be able to see that butterfly pattern on radiology. And that is basically how they might ask you those questions. They're going to have a lot of buzzwords. They're going to be very, very clear. And it's going to be a very clear image, usually the ones directly from the slides. So you're going to have those weird terms of, oh, it's this biconcave. This is a butterfly appearance. This is a race car appearance. be familiar with those terms as well as the different types of modalities that you can actually use. So you can use a CT scan, you can use an MRI, and then know the different types and how they look like. So MRI can be T1, T2, or FLAIR, and know the difference between those just visually. I'm not saying you need to go into the technicalities of it. This is not radiology, the parallel. Now, for resources, which a lot of people depend on a lot, I said it's you and Allah, but actually, there are obviously a lot of resources that you can use. You can use osmosis, which I think really simplifies things a lot. And obviously, you can use boards and beyond. For me personally, I just went through the slides, and for anything specific that I felt I did not understand, like any special tests that were mentioned in clinical, I would then refer back to a video or just a Google search where I would be able to understand those things better. All right, now post midterm, what is super, super important, I told you guys, is psychiatry. Psychiatry is taught by the one and only Dr. Ali Jarati, who is absolutely a phenomenon. He is very, very, very fun. He teaches by telling you stories, and it's basically this rant session. So he's just going to tell you, oh, this one patient, she kept on calling me, and I decided to like lock my phone, and then he'll tell you something that's completely out of pocket, like, and then she decided to, you know, unalive. So just be ready to go through everything in those lectures. Be present. Just take it as something that is very, very fun. Most of his slides are going to have pictures that will link back to the stories that he has shared with you. And through those, you'll be able to remember what he actually wants you to know. And he will have some text that is very, very important that he will focus on. He will tell you, if I ask you this in the exam, this is what you tell me. And he will be very honest about that. There's also something that is called the DSM-5 criteria. The DSM-5 is the holy grail of psychiatry. It is what they always like to use. It is this book that has the list of the different clinical presentations that you might have. So know those very, very well. They have their own mnemonics that he will teach you as well that will help you in memorizing them. But they are very important for you to know and very important for you to differentiate. So for example, depression and anxiety might coexist very often, but they do each have their own DSM-5 criterion that you should be able to distinguish between. Psychiatry is very high yield for the final, so be sure that you actually go through those lectures. And honestly, you'll see that the second time around that you go over them, it will immediately click in your head. You'll remember all the pathways, you'll remember all the stories, and it will be very, very enjoyable. The last discipline, per se, that I wanted to talk to you guys about is labs. Labs are very, very, very important for the OSPE. You have three types of lab: physiology lab, micro lab, and anatomy lab. And I believe you had anatomy lab for this week, but you had physiology lab last week. Physiology lab is very, very basic. They don't expect you to know absolutely everything. This isn't ECGs, these are EEGs. So know where you place the different beads or the electrodes, know what they are named, because we did not think that that was important, but it was for our OSPE. And know the different types of brain waves that you might have and what they each signify. So did the patient have their eyes open? Did they have their eyes closed? Were they active? Were they zoned out? Try your best to link that back once again to physiology, because you will be taking a lecture on those by Dr. Abdul Ahad. So link that back to what you have taken and just try your best to remember the lead placement and everything. For micro lab, I'd recommend that you try your best to actually study the lecture before you go, just so that you're familiar with what you're looking at, and when they ask questions, you're able to interact. You will be looking at a lot of different types of agars, and they will ask you, oh, is this selective? Is it non-selective? Is it, what type of media is this? So they'll show you like a blood agar. They're going to be like, okay, what is this? It's an enriched non-selective media. What are we going to use it for? So on and so forth. And then they might show you the different types of CSF and the analyses that you can predict based on that. So once again, it links back to the table I told you guys about, where every different etiological agent will have a different presentation on CSF analyses. Lastly, they will be mentioning special tests. So for example, they might tell you that for Staph aureus, you're going to be using this test that will be able to show you that it is Staph aureus. For this specific thing, we're going to use the bacitracin. And then if it's resistant, then this is gonna be strep agalacti. If it's not, then this is so on and so forth. So remember those special tests because they might bring you a picture of them in the OSPE, for example. It's less likely that you get actual MCQs about them, but they're very high yield for the OSPE. Lastly, which is the bulk once again, is the anatomy lab. Now, I recommend that you try your best to be very handsy. Try your best to touch things. Try your best to familiarize yourself with everything that you're seeing. There's a special feeling that you get just holding a person's brain in your hands because you're holding that entire person's life. You're holding their emotions, all their thoughts, every memory that they've ever had. And I want you guys to just take a moment to actually appreciate that. Take a moment to realize that you're very blessed to be able to have this type of opportunity, to have this type of privilege, to get to see someone's brain this close. And as you do that, try your best to look at the different gyri, the different sulci. Although they differ slightly per person, it's not going to be something that you like trace with a pencil. Try your best to just realize, okay, this is what I'm doing. And then as you look at the different cross sections, realize the anatomical relations between things. Because when you look at them in a 2D version, it's going to be very different than when you look at them in a 3D version. So try your best to correlate, okay, this is going to be anterior to that, this is going to be superior to that, so on and so forth. There will also be a model that they actually have that is sliced up, basically, and you go through every level individually. And I think that is a very, very beautiful model. It's very, very beneficial. So try your best to get familiar with every single thing that you see. Even if it's not necessarily mentioned in anatomy, it is good to know it just so that you know its anatomical relation with something else. They likely will not ask you about it if it's not something that is mentioned in anatomy. But if you were to see it on a cross section, you would not confuse it for something else because you know that, oh, this is that. This is like the ciliary body, for example. Try your best to link back to pathology as you're looking in the anatomy lab, once again, for blood supply and stroke. Because when you see the sagittal sinus, when you see the different, like the actual circle of Willis, you'll be able to visualize a lot better where each artery is going. And then try your best to correlate that to, okay, if I were to have a stroke or a block here, what would happen? If I were to have a berry aneurysm here, what would this obstruct? And this can help you when you're studying, once again, your second study or your third study. So they will also have a case section as one of the stations, and it gets a bit redundant towards the end. However, if they focus on a topic multiple times, then you can expect that they will be likely getting you this topic in the exam. So the cases, in my opinion, for cerebellum, in my personal experience, were very, very important because they mentioned them a lot. So know the different types of presentations that you might have, if the vermis was affected, if the other areas were affected, so on and so forth. So get your gears turning by figuring out the cases, get familiar with the different types of presentation. And this is basically a continuation of the clinical aspect where you try your best to figure out what the actual differential is for your patient. Okay, I've studied everything very, very well. I am ready now to actually apply that information. And the way that you do that is through the assessment, where you have TBLs, PBLs, the midterm, and the final. It is a lot, definitely, but in my opinion, having TBLs is actually a blessing. For my batch, they told us we would have two TBLs, both worth 5%, but we ended up only having one TBL worth 10%. So luckily, alhamdulillah, you guys have six TBLs, and I feel like those TBLs will provide you with a unique opportunity to try out different study methods. So experiment if you feel like in one TBL you did not perform very well or you did not perform as well as you would have wanted to, and for the next TBL you can alter your study method slightly and try to follow the tips and tricks that you've heard from seniors to actually be able to ace that second TBL. Alhamdulillah, each one of them does not weigh very, very much, but they are an absolutely wonderful way for you to pace yourself and stay on track. Since this is a very long block, you might lose track at some point. You might burn out at some point. You might feel tired at some point. So those TBLs are a way for you to still be on track, to still be on top of things. So still try your best to score as highly as possible. PBLs are incredibly important for SAQs. Take each case, once again, as if it is a clinical presentation of a patient to you. Start off with a huge list of differentials that you gradually narrow down based on, okay, he has this, so it's not that, and he doesn't have this, so it's not that either. And eventually reach the final point where you understand what this patient has, correlate that back to your lectures, and have a comprehensive picture. Your midterm, which is on February 18th, is going to be very, very, very anatomy heavy, especially the spinal cord. A lot of people think that brainstem is going to be the majority of the midterm, but in our case, I'm not saying it will be the case again. In our case, the final had more about brainstem than the midterm did, and the midterm focused a lot on spinal cord because they won't really ask you much about it again in the final. So be very familiar with those tracts, be able to trace them up and down and at any vertebral level and correlate that back to the different spinal levels versus vertebral levels and link back this anatomy to all your other disciplines as well. Be able to solve clinical cases that present to you because they're less likely to ask you about normal anatomy than they are to ask you about the actual lesions. So use this midterm to also show yourself that, okay, I am actually doing well. I am actually figuring things out. I do actually know what I'm doing. And if you don't score that well, perfect. Okay, now I can do better for the final. This is a wonderful opportunity. And I'm so, so glad you were able to get the midterm back. It's a wonderful opportunity for me to fix my study method for the final. Now, the final itself has the 2 week break before it, and some people were requesting that you remove it, which I personally disagree with because it is a golden opportunity for you to study. If you feel like you're missing out on Eid and festivities, then try your best to finish earlier on so that you can still enjoy those things. And I actually think it is very important for you to enjoy those things and get that break with your family. The final is going to be about 100 questions, I think. So it might get a bit draining to solve. It might get a bit tiring to solve. So try your best to pace yourself by solving questions every single week. Try your best to pace yourself by gradually increasing the amount of questions that you're doing until you actually reach the final. Expect a lot of clinical cases. Once again, they're less likely to ask you about normal anatomy, even within anatomy itself. I'm not saying they're just going to ask you about clinical. Within anatomy, they will focus more on the lesions, on the thrombi, on strokes. And so you should be able to be familiar with those. The OSPE will focus a lot on your labs, and the SAQs will be most likely from your PBLs. So we got an actual PBL case again in our SAQs. MCQs, the most high yield are blood supply, the brain stem, and psychiatry. So all lectures of psychiatry are very, very important. But if I had to pick, I would say probably depression and anxiety just because they are the most prevalent diseases that we have in our community. Okay, everything is clear so far. I've gone over everything, but what about your concerns? What about the things that you guys have brought to my attention? So you guys have very kindly mentioned all of those aspects, and I felt that I had to give them their own slide, particularly this one in the center. So burnout is something that is very commonly worried about in neuro and very commonly brought up. In my opinion, burnout is part of the process in neuro. It is not the end of the process. So don't beat yourself up too much if you feel like in the middle of the block you're getting tired. Absolutely not. That is the perfect chance for you to take a break. Because of how long the block is, absolutely nothing will happen. I guarantee you, nothing will happen if you take 2 days off to yourself. It's completely okay to take a break. It will make you more productive. Rest is also productive. It will make you come back stronger, more refreshed, and you'll be able to actually approach everything with a fresh mind. So once you take that break, you get back, everything will start clicking back into place. So give yourself that break. Realize that rest is also productive. And it is okay for you to just be tired at certain points. So use the length of the block to your advantage. Pace yourself, take breaks. Don't be afraid to just say, okay, for today, I will not be studying this. And that's completely okay. Another issue that people typically face is that the parallels are actually also very neuro heavy. And what I mean by that is that you'll be taking BHS where Dr. Nihal talks about child psychiatry, and then you'll be doing radiology where they show you an MRI of the brain. And then you'll be doing pro, where you're talking about reflexes again. So all of those together kind of don't give you an escape out of neuro. You're like, I just need a break. I just need to like study something that's not neuro. So it feels like a lot. And for that, I'd recommend that you once again compartmentalize and try to focus on just the block and then just the parallels. Don't try to overwhelm yourself with everything all at once. You have plenty of time, inshallah. For electives, since some people were asking me about those, I would recommend that you finish all your electives before you reach third year. If you're not able to, then that's okay. But you will thank yourself in the future if you did actually finish all your electives. Secondly, some people were worried about HNS being after neuro and the post-neuro burnout that is very, very common. Now, HNS depends a lot on neuro, and if anything, it's basically a separate block just because they couldn't have one 9 credit hour block. So if you study neuro well, you will make your life a lot easier in HNS. It is the work hard now so that you can rest later mentality, but that is actually true. Now, a very, very common theme that I saw is Ramadan and Eid and managing your religious duties with your studies and with family time and how you're able to actually focus on all of those together. Once again, I believe that if you're able to pace yourself, you should be able to find the time. Now, in Ramadan, you will be at the end of the block. So the lectures will no longer be as heavy. They will no longer be as condensed. Most of the bulk of neuro you would have already taken in spinal cord, brainstem, basal ganglia. And it's mainly just psychiatry. You're mainly just taking pharma. So it will be a lot lighter. Definitely do not compromise your religious duties just so that you can study. Try your best to manage the two. Try your best to be able to stay on track from the get-go so that once you reach Tarawih, you can actually have time to do that. Right before the final, because of the Eid break as well, unfortunately, you might have to give up on some of the joys that you would have experienced otherwise. But I do not think that that should take away entirely from what it is. I think that you should still be able to stay on track with your studies and basically just transition to being very, very quick with your review, being very quick with your question solving, that it does not feel like you're taxing yourself too much throughout Eid or throughout Ramadan. That brings me to my point about managing your time. So pace yourself with your TBLs. Pace yourself by trying your best to solve questions about that entire week by Saturday or whenever the exam committee releases their document. Try your best to, even if you're not always on track, to still be present in the lectures, to still understand what's happening in the lectures. And this brings me to something that is very, very, very important. A trap that a lot of people fall into is that they expect their pace in neuro to be like their pace in any other block. So they think, okay, I'm gonna be doing the like 3 anatomy lectures today with 2 pharma lectures. And then they don't end up doing that and they feel very dejected. They feel very disappointed in themselves. And that kind of sets you up for failure. Because since neuro is so anatomy heavy, what I would recommend doing is basically overestimating a lecture. So give it more time, give it all day if it needs to. And once again, it is quality over quantity. So if one anatomy lecture takes an entire day from you, don't beat yourself up over it. It is okay. The other disciplines will not take as long, but anatomy will be the bulk, so it is okay for it to take time. Don't expect yourself to magically be able to sort through all of the lectures, to just go through everything all at once. It is okay. Take your time. Okay? So if you set, let's say, 3 hours for one anatomy lecture and you finish in two, perfect. I have this extra hour. Now I can either take a short break or I can actually fill it with more lectures and be even like progress further in my study plan than I had intended. But base your study schedule around realistic goals so that you don't overwhelm yourself and you don't not constantly feel like you are behind. Okay? Your study method should always link back to anatomy, and you should carry over with what has worked for you. Because all of those disciplines are disciplines that you have done before, if it worked for you in previous blocks, if you were satisfied with your performance, it will likely not change much for neuro. Will I be able to get an A? Is getting an A possible? Absolutely, it is. I got an A, alhamdulillah. A lot of my friends got A's, alhamdulillah, and it is possible. If you're very, very worried about it, there's a huge plus, which is the progress test. This progress test, if you were to actually participate in it, you can push your grade up from an A minus to an A. And that's, in my opinion, as good as an A. So work hard, aim for an A, and you will get it, inshallah. Don't think that, oh, it's gonna be impossible, or oh, I'm not able to do it, or it's too heavy. It is a lot of information, but it is manageable, and it is something that the more you do, the better your outcome is likely to be. The last point is about difficult exams and tricky questions and being faced with a question that you might not really understand very well. Now, for that, I would recommend that you take it one by one. So look at what they're presenting with. They're going to give you a huge list of symptoms all at once. Take it one by one and know what that means. Like if they tell you they're going to have a right-sided weakness, think, okay, so this is a motor type of lesions. I don't know if it's upper motor neuron, lower motor neuron yet. I don't know at which level it is. Then you can move to something else. But you have that idea in the back of your head so that at the end you can correlate all those keywords together to reach a final answer. And that brings me to this very fun exercise of solving this question. I will give you a couple of seconds or minutes, I don't know, to go through this question. Read it very carefully and very slowly, and then tell me what you think the answer is. I love the uh-oh. I love that that's the only. Okay, so we got an A. Okay. Uh-oh is absolutely amazing. We got a raised hand. Go for it. Honestly, if you want to unmute, feel free to do so.
That was an accident. Actually, I have no idea. So sorry.
Fair enough. It's completely okay. All right. Any guesses? Okay. A, F. All right. A, B. Sure, yeah. I mean, you got it, definitely. That's correct. I played the fifth. Okay. So since you guys have not done Blood Supply or the Cerebrum yet, I was not expecting you guys to be able to answer this. But the reason why I got it is because this is a typical neuro question. This is how your questions are going to be. And I don't want you to be too overwhelmed when you actually see them in the exam. So I will take you through this step by step. Can you see my pointer? I think you should be able to. Yes, all right, perfect. Okay, so we start off with a 66-year-old man. Okay, so him being male might be important, his age might be important. We don't know if this is asking about tumors yet. Woke up one morning and could not move his dominant right arm or hand. Now there's the free pass session. Now, the reason why I'm doing this is because a lot of times, you know how they tell you in and questions, you just need to like go to the end, know what they're asking you about, and then read all the clue words. In neuro, I personally do not think that works because everything in that question matters. Everything in that question is a clue. So look at what they're saying here, or what I am saying here, because I may or may not have done this to you guys myself. His dominant right arm or hand. If I'm talking about a dominant right arm, then I'm talking about a dominant left hemisphere of the brain. This is a rule that you guys should know. Dominant left hand, dominant right hemisphere of the brain. And why this is important, we'll get to in a second. He had trouble trying to speak to his wife, but could understand her questions and follow her directions. So he had no issue with understanding, but had an issue with forming speech. This is something called Broca's aphasia. Okay? Broca's aphasia happens when the side that is dominant gets affected in a specific area that is called Broca's area. At the hospital, neurological exam revealed paralysis of right lower face muscles, but he could wrinkle his forehead on both sides. And what this signifies, as you guys will take later, is a lower motor neuron type of lesion. And then paralysis and hyperreflexia, sorry, upper motor neuron, guys, sorry, and hyperreflexia of the right hand and arm. So hyperreflexia up goes up for upper motor neuron. Actually, though, I think it's C, and you're absolutely correct. It is C. Good job. Mild sensory loss in the right arm, hand, and face. So if I'm talking about all the symptoms on the right, I will typically in the brain be talking about something that is going wrong with the left hemisphere because it flips. Okay, you have a crisscross. So immediately that makes me take out E and D. And I'm not too sure about B and F, right? But since I have two different sides, then it's likely not going to be a specific artery that is just in the center. So it's not F or B. I am left with A or C. Left thalamic striate is going to supply the thalamus and the striatum of that. Nothing here is really giving me symptoms of a thalamus type of issue because in the thalamus, it's the relay center for everything. But the left middle cerebral artery would be absolutely correct because I am supplying a specific area of the cerebrum, including Broca's area, that is causing this patient's presentation. So if I am high enough up in the cerebrum, then the left side getting affected will affect everything on the right side. As I go lower down to the brainstem, then you need to start to have two different ideas. As you move further down to the spinal cord, it also depends on the level and if you're thinking of motor or sensory. So I want you guys to approach the questions very systematically. I don't want you to be overwhelmed with the amount of information you're presented with. Take it one symptom at a time and understand what each thing means. They're using a lot of fancy terminology, but it will make sense once you're actually able to follow along with it. Okay? Now, my personal helpful links that I have used are linked here in those YouTube channels. I think they were very beneficial for my own understanding. If you guys would like to solve some questions, I have linked a neuroanatomy quizzes website, and Amboss is always very good for questions. Once again, Pretest is a very, very good resource for anatomy questions. The lovely academic aid, I have come full circle from last year, has provided you with a neuro student guide that is very beneficial as well. MashaAllah. They have a second year deck for Enki. And if you have used Enki in POD and it was beneficial for you, then definitely continue to use it, especially since anatomy and pharmacology are very, very memorization heavy. And once the mock exams are released, I recommend that you do those so that you can gauge whether or not you should be focusing on other things. Of course, your batch committees are doing an absolutely wonderful job of recording everything, of giving you guys practice questions, giving you transcriptions, giving you images about everything that you're seeing in lab, and compiling your PBL cases for your SAQs. So those are very important to go over. And finally, PAL sessions. Stay tuned, you guys. PAL sessions will be helpful, inshallah, as well, in giving you guys what you really need to know for every discipline and for every doctor. That brings me to the end where I would like you guys to unmute yourselves. Just ask me anything that you'd like. I really, really, really hope that I was able to actually cover everything and answer any of the questions you might have had. But please go ahead and ask me any questions that you may have. Since this is a Zoom meeting, some of you might start leaving. So I will just put this here to please scan this QR code before you leave. And the questions are, it's time for you guys to ask me anything that you want. I will be here for as long as you need. So please go ahead.
Thank you so much, Farah. I want to give you a round of applause since we're not in person.
Thank you.
Thank you so much.
Thank you, guys. All right, you actually have a question. Please go ahead. If you guys want to unmute as well, please do so. I would have absolutely loved to actually see your faces and be able to interact with you, but it's okay. Hopefully, this was still beneficial. So please ask any questions that you may have, anything at all. I don't care if I've already mentioned it. I will mention it again. Just ask me any questions. Um, Thank you guys for attending. I really appreciate it. This is a controversial opinion, but I tried so hard to use Anki, but I can't. So for concepts that I need to memorize, what do you suggest I do? Okay, so I also personally do not use Anki, and I've made it this far. So Anki is very user specific, in my opinion. For those that it works for, it really works. But for some people, it just does not, and that's completely okay. The way that I memorize things is it depends on the card maker as well. Yes, that's true. So the way that I memorize things depends on the discipline. So for example, for pharmacology, as I mentioned, I make up those weird mnemonics and those random stories for the drugs as if they're characters. And although that will obviously not work for every single drug, like making up a story, it does help you retain as much information as possible. Otherwise, for anatomy, what I like to do is to either draw things out myself or to teach the content to someone else. Because as you're teaching someone else, you're basically consistently using active recall in the sense that you will begin to notice the gaps in your own knowledge. You will think, okay, there's something here that I should be explaining to them, but I don't know what it is. I forgot what it is. And that makes you go back and remember that specific thing, and it helps you actually retain that information. So try your best to simplify it in terminology that makes sense to you and in terminology that you think would help that other person understand it. And in doing so, you help yourself retain that information and you help yourself remember it the way you explained it. When you draw things out as well, you basically are forced to visualize it by your own hand. So it brings a somewhat concrete aspect to otherwise abstract details that I think really helps with your memorization. Otherwise, there's the point of like repetition, where just consistently repeating the same kind of information and going over the lecture multiple times will help you eventually let the information stick, as long as you don't do that passively. So as long as you're not just reading off the slides and not doing anything about it. Repeat in the patterns that Dr. Yaqeen uses, and then try your best to implement that with questions, because I feel like questions really cement all the concepts into your head. So solve as many practice questions as possible. I hope that answered your question. All right, perfect. I'm glad. Of course. Okay, any other questions at all? Is there anything else you guys would like to ask about? This is so good. I am so, so glad. I'm really, really, really glad that this was beneficial. I tried my best to cater this to something that would actually help you. Do you recommend taking notes for this block? Absolutely, especially for Dr. Yaqeen. Even if I'm not saying you have to transcribe everything, but my personal study method involves a lot of note taking. So I would heavily recommend that you try your best to take notes along with Dr. Yaqeen, just so that you can focus more with him. Even if you don't refer back to those notes, even if you don't get absolutely everything on paper, or like in your notes, it is okay as long as it was able to help you focus more during the lecture, which I think is the real reason why most people take notes. So I would absolutely recommend it, especially for anatomy. Notes during the lecture or for first study. Personally, I think during the lecture, because it helps you stay focused and it helps you fill in any gaps, because Dr. Yapin repeats himself very, very often. So even if you were to miss something in your notes the first time around, when he says it the second time around, you can fill in that gap, and that will help you focus and it will help you retain that information a lot better. For first study, you can then go over those notes, you can go over the lecture, and then make your own notes again in a form of active recall where you try to write down everything that you think that you just studied. Touche. I like the pun. Okay. Any other questions? I hope that answered your question, by the way. Of course. Any other questions at all, you guys? Anything else? Guys, this isn't a PAL session. I'm not teaching you something now. I'm being a colleague. So please just ask if you have any questions at all. And please scan this QR code before you leave. I have also included my email and my phone number in the end of these slides for anyone that would like to reach out to me. Please do so at any point. And I mean at any point. I am more than happy to answer your questions. I am more than happy to help in whatever way that I possibly can. So please feel free to reach out to me. Please feel free to reach out to any of your seniors. You are not alone in this block. And you can get an A, and inshallah you will get an A. I'll be keeping you all in my prayers, and I will continue to check up on you throughout this block for your feedback. So please take care of yourselves. Best of luck with brainstem tomorrow. It's very, very exciting. I hope it goes well, and I hope you're able to retain the information. Please feel free to reach out. Thank you, guys. Wait, I need to do this once again, just to show appreciation for the shirt again. No, it is exciting. Okay, it is exciting. Please, it's exciting.